Let's spend a couple moments talking about the basics when it comes to your ovarian health. So our ovaries are almost almond-sized organs that are in our body, and essentially they help to make us the women that we are. When it comes to our ovarian health, it's so important that we know our risk for developing ovarian cancer and that we're ovarian self-aware, a word that we're so proud of, right, Pink, to have created. Here's the thing with ovarian cancer. It's far less common than breast cancer. 1 in 67 women will develop the disease during her lifetime is the average woman's risk. However, it is the deadliest gynecologic disease. And in fact, 2/3 of women who are diagnosed with ovarian cancer will die as a result. Often it's known as the silent killer for many reasons, but a couple of them being that its symptoms are very vague. Things like feeling prolonged bloating or constipation, difficulty urinating, just a distended stomach, things that, many women just feel on an ongoing daily basis. And we're not talking about, having menstrual cramps, and we're not talking about eating too much Chinese food and being bloated. We're talking about symptoms that persist or worsen. It's so important that you ask your doctor, could this be my ovaries, and bringing that to the attention. The other reason is we don't have a good test for this disease. So that's why being ovarian self-aware is so important. The only other point I want to make sure that everyone knows is that when it comes to breast and ovarian health, breast and ovarian cancer are actually related. These diseases run together in families. So it's so important to make sure that you know your family's health history. And how do you do that? You want to make sure that you're collecting both from your mother and your father, your biological mother and biological father's side, who had cancer, how old were they when they were diagnosed, and what kind of cancer. And you're bringing this information to your doctor because, we get 50% of our genes from our mother, 50% from our father. And whether it's breast cancer, ovarian cancer, or others, we need to be elevating that information to our doctors because it has a direct influence on our risk as well. So remember to be ovarian self-aware, to understand that connection, to know your family's health history, and continue to be proactive with your health.